I'm at the AHA this year to present the results of the ORION-9 study. So the ORION-9 study was a study in subjects with familial hypercholesterolemia. Now, most people don't know familial hypercholesterolemia is one of the commonest inherited diseases in the world. So it affects about 1 in every 250 people. So worldwide there's about 30 million people that have familial hypercholesterolemia. In the United States, for example, we estimate there's probably about 1.3 million people with familial hypercholesterolemia. So they are at high risk for premature atherosclerotic vascular disease because they have a lifetime high LDL cholesterol level, which is usually about twice the normal level. So when they're the age of 20, their arteries have been exposed to twice as much cholesterol as somebody with a normal level. So we thought this was an important group to study with this new drug called inclisiran. Inclisiran is a small interfering RNA drug that works in the liver to inhibit the production of PCSK9. There are monoclonal antibodies against PCSK9, but monoclonal antibodies are cleaning up the PCSK9 produced by the liver. This is turning off the tap, so it's actually stopping the liver producing cholesterol. So it was a big study. There were over 600 patients screened. We enrolled 482 patients, and they were randomized 1-to-1 to either inclisiran, given at day 1, day 90, and then 6 monthly until the end of the study. It was an 80-month study. And the results were very impressive. Inclisiran compared to placebo reduced cholesterol by about LDL cholesterol by 50%. That was at the end of the study, the primary endpoint at day 5-10, but there was also a time average reduction. So over the duration of the study, LDL cholesterol was reduced by about 45%. And this was on top of background therapy. So 90% of the patients were on statin therapy, the vast majority on high intensity statins. Over 50% were also on ezetimibe, so they were quite a well-treated group of patients. But despite that, they had an LDL of about 150 milligrams per deciliter. So the introduction of inclisiran allowed a big proportion of these patients to lower their cholesterols to better targets below LDL of 100 or even 70 milligram per deciliter. And that's only with an injection twice a year. So I think where will this drug have a place? I mean, you've got 100% compliance. If the dose is administered, you're guaranteed a reduction in your LDL in the region of 45% over a 6-month period. So how will the drug be administered? Will it be the general physician that sees the patient twice a year, much like a flu vac, just gives them the drug and there's 100% compliance? Because one of the problems, I mean, statin is still first line, but you've got to take your tablets every day. And monoclonal antibodies against PCSK9 are also good drugs, but that requires a twice weekly dose, so a dose every second week. So that's about 26 injections per year, as opposed to this medication, which is only twice a year. Is there a price to pay? What about side effects? So some patients do get an injection site reaction at the site of the injection. In this ORION study, it was slightly more than in some of the other ORION trials. It was about 13%, but all of these were mild, all transient, none of them persisted. So there doesn't seem to be any major side effects of this medication. We are going to need a big outcome study, and that is in process. It's called the ORION-4 study, to show that inclisiran will reduce cardiovascular events. But at least in proof of concept for these high-risk patients that have a very high cholesterol level, this is a very worthwhile drug, and I think it has a great future.